Welcome back to the morning show here on Arise News with me, Katira King. My next guest, Dr. Rapu, is a specialist in aesthetic medicine, having trained at London's Harley Street in the performance of cosmetic and anti-aging treatments. Now she performs and advises on a range of aesthetic and minimally invasive anti-aging treatments, including mesotherapy, microneedling, facial rejuvenation, as well as non-surgical facelifts, intravenous supplies, non-surgical weight loss treatments, Botox, dermal filler injections, and so on. Sounds like a woman's dream, right? Well, if you're intrigued, you're right to be. Welcome to the morning show, Dr. Rapu. How are you?
Hi, Katira. I'm well, thank you. Thanks for having me.
Thank you so much for joining us. So today, I feel like we're making dreams come true. We're talking about how to feel more beautiful than you already do. So enhancing your beauty, if you will. And you deal primarily with that within the face, well, the face and body areas. So first and foremost, why aesthetics?
I think I was just really passionate about aesthetics. During the course of medical school, working in a hospital, I was always sort of noticing the cosmetic concerns about people, hair loss and lines on the face. So, and I noticed Nigerians, especially, are just really into beauty and how they look. So it seemed like a really interesting area to go into, and I just explored that a little bit more, and I find it so exciting.
It's amazing because it's not an area that we have or that has reached optimum saturation, if you will. It's still quite new in the industry or in the country. What are you finding the reception like?
I find people that are sort of more into pop culture, aware, watching TV, are sort of more receptive.
Right.
But there's a lot of having to inform people and speaking really plain terms about what exactly I'm doing, because even sort of my colleagues are still like, we have no idea what she's doing. So there's lots of like informing people, telling them I've done it before, using simple terms, before and after photos, and Nigerians are quite intrigued and they find it exciting, so I think it's just sort of getting them into it. And then a lot of people who have been having these treatments done abroad and coming and just Google and find us. They're probably most of my clients at this point.
Oh, wow. Okay. So for the layperson like me, tell us the difference between a cosmetic surgeon and a cosmetic doctor.
So I'm not a surgeon. A surgeon sort of does incisions and you go through surgery and cuts people open. But the field I specialize in is minimally invasive, so lots of injections, no sort of cutting you open, things you can come in and do on your lunch break, and no one has any idea, no downtime, so you just come in and you go. And so nice, subtle changes as opposed to, you know, I'm in hospital taking painkillers and I've just had a surgery done. So I think people prefer that, you know.
So when you say a lunchtime procedure, I could literally walk in. So we can see one of the treatments going on screen now. You're saying this takes, what, an hour during one's lunch break?
Usually.
Wow.
So usually less than an hour, where we numb you for about 20 minutes for a few of the procedures and then get to it. And it's something you can literally come in to do during work and go back to work.
So what is this treatment taking place now?
This is a microblading treatment. It's a form of semi-permanent eyebrow enhancement. So we take away that need to sort of use your eyebrow pencil every day and you just sort of have your eyebrows nicely enhanced. So it's a method of semi-permanent eyebrow tattooing, which I do as well.
Wow. Okay. So let's role play for a moment and say I walked into your clinic and I wanted to get some Botox done.
Okay.
And I had 35 minutes. Go.
I'd say, hi, Katira, how are you? Because these procedures are newish, people sort of coming, rushing, I want to do this, but it's a medical procedure, so I make sure you understand what I'm doing. Do you know what Botox is? I would explain to you what it is, how it works. We go through consent forms. Usually I would ask you to go home, read, and then come back. So I wouldn't usually do the procedure on the same day. Just making sure you're aware of what we're doing. If all is good, we go through sort of, you know, possible risk factors, everything, what it feels like, then we go ahead and we're done in about 30 minutes. I call them beauty injections. They're not too painful.
I love it. Okay, so that was my next question, because we can see something going on screen now. That was 3 needles going into the face. It does look quite painful. Tell us the honest truth. How painful is it?
We have some procedures I would say are not very comfortable, but I don't usually use the word painful.
Right.
I have done most of them on myself, so I can tell you, you know, it's not painful. We usually do numbing, so she's being numbed strongly. And as you can see, I do videos where I'm showing the person's expression, so they never really look like they're in pain. she looks quite comfortable, doesn't she?
She does, actually.
I just wouldn't show her the mirror at this point because just looking at it might scare her a little bit.
So what exactly is this treatment?
I'm inserting some threads. This is called a thread lift.
Right.
So inserting threads into the skin causes the skin to sort of start to produce collagen around the threads. Collagen tightens the skin. Collagen is broken down as we age. So it's an anti-aging treatment. It's also a method of lifting the face. So the face, and it gives an instant facelift. So it's a nice, new non-surgical way of getting a facelift.
Wow, okay. So we have a few before and after photos that we're going to show.
Sure.
I want to know, what gives you the most joy as a cosmetic doctor in Nigeria?
People think this is vanity medicine, but it's so much deeper than that because people come back a few weeks later, even men, and they say, I'm so happy. You know, my wife is so happy with how I look. I just feel how people are excited about me improving their appearance gives me so much excitement.
Oh, wow. So we can see some of them on screen now. Talk us through the excitement in the patients as they saw the before and after photos of themselves.
So I make sure we always take before photos because people would come back afterwards and be like, oh, no, you didn't do anything. So that's a lady who didn't have quite sparse eyebrows. So that's immediately after the microblading procedure.
That really looks like hair.
Yeah, so it looks like real hair, and that would last you up to about 18 months. This is Botox, so people that have frown lines get a bit bothered sometimes, or they look upset, or they look, you know, just not very relaxed. So this is about 2 weeks after a Botox injection. It just sort of relaxes the muscles in the forehead and takes away lines.
Wow.
Fat loss, so this is one of our common concerns. This is after 2 weeks after lipolysis injection.
Okay.
No surgery, no downtime. We just encourage you to exercise as much as you can.
Wow.
Just some injections in the tummy, and then she comes in 2 weeks later and she just feels happy. She can wear, you know, nice tight clothes. This is a cheek augmentation. So you can see the cheek is falling a little bit on the left side, and we've just used filler injections to enhance the cheekbones. So some people like that.
Interesting.
We get lots of pigmentation concerns, sunburn, people picking at their face and coming in with dark spots. So this is after a treatment called the depigmenting mesotherapy, where I just inject brighteners into the skin.
Okay.
And that's about 2 weeks later. This is hair loss, so the picture's a bit blurry, but you can see hair growing a little bit on the right. So that's after one session of what I call scalp mesotherapy. Just inject hair vitamins into the scalp to encourage hair regrowth.
Amazing. Okay, so give us, lastly, if we were looking for advice, and I mean, clearly, if we were looking for a cosmetic doctor, we'd come to you. Yes. But if we were looking outside of the country, what advice would you give us in choosing the right doctor?
I think I see skin of color different from Caucasian skin. So a lot of people are like, oh, I'm going abroad, but I say, ask the doctor, have they experienced with skin of color? Because we get people coming in from abroad who have burnt from certain treatments. So I'd say just main important thing if you're abroad is make sure the doctor that's working with you is experienced with skin of color.
Okay.
And then just sort of, just after talking to the person, I'd say make sure you're comfortable with the person, because you want to make sure the person that's injecting your face, you're comfortable with what the person is doing. So always go through a nice in-depth consultation first, and then if you're comfortable, go ahead.
Amazing. And for those of us that want to check you out, head to Belfiore. How do we do that on social media?
I'm on Instagram, Belfiore Medical, so it's BELFIORE _ medical. And our website, www.belfioreng.com.
Fantastic stuff. Thank you so much, Dr. Aju. We're going to see you shortly after the break because we're discussing vanity.
Sure.
It's time now for a short break on the morning show, but when we return, it's time for our take. Don't go away.